Ventilation is the essential process of moving air into and out of the lungs, ensuring proper gas exchange. In veterinary medicine, understanding these mechanics is crucial for diagnosing and managing respiratory conditions in animals. Let's break down the science behind it. Ventilation is driven by pressure gradients dictated by Boyle's law, which states that pressure is inversely proportional to volume in a closed system. This means inspiration occurs when thoracic volume increases, causing a drop in intrapulmonary pressure, drawing air in. Expiration happens when thoracic volume decreases, raising intrapulmonary pressure, pushing air out. This simple principle governs every breath an animal takes. The pleural cavity, filled with pleural fluid, creates a negative intrapleural pressure compared to the atmosphere. This suction effect keeps the lungs inflated, allowing smooth expansion and contraction during breathing. Any disruption, like pleural effusion, can lead to respiratory distress. Breathing involves several muscles. Inspiration, an active process, involves the diaphragm contracting and flattening, increasing thoracic volume. The external intercostal muscles lift the ribs, expanding the thorax. In cases of forced inspiration, accessory muscles like the sternocleidomastoid and scalene assist. Expiration, on the other hand, is mostly passive. It occurs when inspiratory muscles relax, and lung elasticity helps push air out. Forced expiration engages abdominal and internal intercostal muscles for a more forceful exhale. Lung function is measured using volumes and capacities. Tidal volume, or VT, is the air inhaled or exhaled per breath, which is roughly 10 to 20 milliliters per kilogram. Then we have inspiratory and expiratory reserve volumes, IRV and ERV, which represent the maximum additional air you can breathe in and out beyond the tidal volume. Residual volume, or RV, is the air that remains in the lungs after maximum exhalation. Total lung capacity, TLC, is the maximum lung expansion, about 15 milliliters per kilogram in dogs. Vital capacity, VC, is the maximum air exhaled after a full inhalation. Lastly, functional residual capacity, FRC, is the air left in the lungs after passive expiration. But you know, not all the air we inhale is used for gas exchange. This is where dead space comes in. Anatomical dead space is the air that remains in the conducting airways, like the trachea and bronchi, and does not participate in gas exchange. Physiological dead space includes anatomical dead space, plus any alveoli that are ventilated but not perfused with blood. In conditions like pulmonary embolism or severe lung disease, dead space increases, reducing oxygen delivery. During breathing, pressures shift dynamically. At rest, intrapulmonary pressure equals atmospheric pressure. During inspiration, intrapulmonary pressure drops to around -1 centimeter of water, allowing air in. For expiration, pressure rises to about +1 centimeter of water, forcing air out. In forced expiration, pressure can reach up to +30 centimeters of water, which is useful in coughing or exertion. The transpulmonary pressure, the difference between intrapulmonary and intrapleural pressure, keeps the lungs inflated. Consider a 4-year-old cat presenting with acute respiratory distress. The symptoms include mouth breathing, lethargy, and increased respiratory effort. The findings show muffled heart sounds, dull lung sounds, and pleural effusion on X-ray. The pathophysiology here is that excess pleural fluid raises intrapleural pressure, decreasing transpulmonary pressure and restricting lung expansion. To manage this, oxygen therapy improves oxygenation, and thoracocentesis removes excess fluid, relieving distress. The mechanics of ventilation depend on precise pressure gradients, muscular effort, and lung elasticity. Boyle's law controls airflow. The pleural cavity maintains lung inflation. Dead space affects ventilation efficiency. Disruptions like pleural effusion or lung disease impair breathing. Understanding these principles is vital for effective diagnosis and treatment in veterinary medicine. Thank you for watching. Subscribe for more veterinary physiology insights.